and welcome to Transition Tea, the podcast dedicated to demystifying the world of healthcare transition and activation planning. I'm your host, Christina Olivedia, Director of Business Development and Communications at Yellow Brick Consulting. Today, I'm really excited. We have our own Director of Behavioral Health Services, Dr. Donna Demerjian, on today. Donna, welcome to the podcast. Can you provide our listeners with a brief background about yourself?
Absolutely. Hi, everyone. I am Donna Demerjian. I'm a licensed psychologist. So I have been in the behavioral health care field for over 35 years. So I started out my career as a direct provider working with children and adolescents with behavioral and learning disorders. Then I kind of worked my way into operations, working with various behavioral health care agencies, and found just a passion working in the operations field and really like that. And then as the Mental Health Services Act kind of worked its way through California with all the funding going in through the innovative programs throughout California, there was a lot of startup activities and startup programs going on. So I started doing activation for several programs throughout California. So did that for several years and just found a passion for all the excitement going into opening up new behavioral health care projects. And then met Kelly and her team with Yellow Brick, and she actually helped me on one of my projects. And here I am as part of the Yellow Brick team.
Well, we certainly have seen a lot of focus on behavioral health, especially after the pandemic. So we appreciate you being on. Today, during our chat, we are actually going to be tasting David's Tea North African Mint. So here's Donna. Oh, and that is indeed very, very minty. So listeners, grab your own cup of choice of beverage and let's talk transition. So Donna, thank you very much for your introduction. I think it gave folks a really good idea of, just the depth of experience that you have as both a clinician and somebody who's worked in operations. Can you share, what led you to, pursuing a career in behavioral health care?
Well, I think like everybody, I went to college and had no idea what I wanted to do. I was at Cal Poly Pomona, go Broncos. And I was a business major because I, again, had no idea what I wanted to do, found myself in accounting and economics and just was not energized by those classes. So meandered over to the behavioral sciences classes and just fell in love with psychology and sociology. I think I just was really interested in how the brain worked. So just really liked those courses, went and got my master's degree and knew I really wanted to work with kids. So my first job out of college was working in a residential facility for kids that had been removed from the home due to severe abuse and trauma. So really difficult first few years working with those kids, but I just loved it. It was really, really rewarding work. So that's really what started me on my pathway in my career.
You touched on something, and I always ask this. I myself am not a clinician, but the work you do, it's got to be hard not to take it home. How have you navigated dealing with those difficult cases and those ones that keep you up at night?
Not well at the beginning, right? It was really, really tough at the beginning, but I think you learn to cope with it. And I think some of us don't cope well, right? There's a lot of vicarious trauma for caregivers. Certainly we see that in the healthcare facility, to the healthcare field too, right? With nurses, certainly with COVID, so many nurses and caregivers have really not done well. And I don't think we've done enough to support them, but we see it with our mental health support staff as well. So I think we do need more to support those. For me, I think I was fortunate that I was able to deal with it. But then at some point in my career, I think I did go into operations, right? At some point, it's like, okay, I think I've done enough on the provider end of it, and I think I'll go into operations and be a little bit more detached from it. So it was kind of a natural transition for me. Yeah.
Well, we certainly, with the pandemic, have seen tremendous focus on behavioral health facility development. I think it certainly has piqued a lot of folks' interest, and probably as a provider, this is something that you've seen a long time coming. But can you share, what your ideas of what has been this driving force, this sudden increase of demand, and what you foresee happening in the next few years for behavioral health development?
Yeah, it's been a long time coming. I mean, as I've seen, like over my career, we've been very, very fortunate in California, right? We do have the Mental Health Services Act, and for those of you that aren't familiar from other states, it's the millionaire tax. We passed it several years ago for anybody earning income over $1 million. It's a 1% tax that's set aside for very innovative mental health programs. So we have a lot of great mental health programs in California, but those in other states aren't as fortunate. But really what's been happening in the last several years is just a lot of mental health awareness. And we're all seeing it, in the media, not only on the news, but in social media. And, it's really destigmatized mental health. So people aren't afraid to come out and say, yeah, I've been struggling with this. And people aren't afraid to come out and get help. Unfortunately, we've had a lot of celebrity and sports figures that have, died of suicide. So that's brought it out into the forefront. And then we've had the pandemic, which has seen a huge increase in anxiety, depression, especially among our youth. And I think we're going to be seeing that ripple effect for years to come. And I think it's really brought to the forefront the lack of services and resources. And I think we all know somebody, if not ourselves, who have tried to get services and found out there's no place to go. There's huge wait lists, or people just don't know where to go. They try to call their insurance provider and there's just wait lists, or they're told, sorry, there's no openings. So I think what's happening is facilities and hospitals are finally realizing we need to do something. The huge epidemic or crisis, whatever we want to call it, is emergency departments. And I know those of us in the behavioral health field have been talking about it for years. We've known about it, but I think everybody else is starting to realize that, the emergency departments, the beds are a lot of them are filling up with clients that are in behavioral health crises. These are little kids, 5 and 6 years old, all the way up to geriatric patients, because there's no place else for them to go. When somebody's experiencing a behavioral health crisis, they end up in the emergency department. And if there's no beds available, that's where they sit. Sometimes they sit for days, even weeks at a time, and there's really no treatment for them there. Sometimes they end up with a security guard watching them, which is really not adequate treatment. So I think the hospitals are realizing this. They're realizing they need to do something. It's not good for the behavioral health client that's sitting in there, and it's not good because it also takes a bed away from somebody that's in a medical crisis that needs that bed. So it's great that everybody's realizing that. It's been a long time coming, and I'm excited to see what's going to happen over the next few years to kind of take care of this long growing problem.
Well, I know you attended many conferences, healthcare facilities, healthcare design, and you were really optimistic out of those
Yes.
conferences with all of the various projects happening. Our own president and founder kind of had an inkling about this prior to 2022, before this really has become an overall trend. And because of this, we were so lucky to have you and Kelly Guzman really launch that behavioral health service line in 2022. You're a fearless leader, and can you provide us some summaries of what's the difference between approaching a traditional healthcare transition and activation and a behavioral health transition and activation project?
Yeah, absolutely. First of all, so excited to be part of the Yellow Brick team and lead this in terms of the behavioral health service line. So and so excited that Yellow Brick is recognizing that. And going to these conferences, you could just feel the excitement in terms of the healthcare design firms wanting that part in terms of that behavioral health, that behavioral health specialist. So in terms of the differences, let me talk about the similarities first, because I think there are some similarities. In terms of project management, I think those basic project management building blocks are the same, right? In terms of, we're still going to draw from that basic timeline and those elements. In terms of those project management tools, we're still going to use the basic toolbox. But I think we need to remember that they're very complex clients, right? They're very different from healthcare clients. They've got a unique set of needs, and we need to remember that when we're kind of building those operational workflows for them, right? They've got their own set of evidence-based practices that we need to build those programs around. We also need to be very mindful about the design. And I think it's very important to have that clinician voice in the design portion of that and from the very beginning, because safety is number one. And you can't just, build that facility without having that in mind, because sometimes you can't go back and rebuild it, right? And the number one risk of patients in these facilities is suicide, and really risk by strangulation. So that ligature, making sure there's no ligature points in terms of where patients can wrap a bed sheet and strangulate themselves, or self-injury from cutting themselves or using sharp objects. Those are really the number one things you need to be mindful of. And then I think the other item that really we need to be mindful of are the workflows, the operational workflows, in terms of how you're going to manage risk, how you're going to supervise clients in terms of observation and line of sight, and how you're going to respond to the psychiatric crises in terms of the kind of the risk management plan. So I think those are the main points to be mindful of in terms of managing the project.
Well, thank you for that. I know when I've been really fortunate. I've got to work with you a lot, Donna, and I'm so glad because you're just such an expert in the field. So as we assess the development of the behavioral health service line this year, I love that you highlighted the similarities first, because I think we went to the drawing board and said, let's scrub everything, let's change everything. And then as we began to assess that overall process, you did note, why do we have to change this? Let's just use, the expertise that we've already developed, that toolbox, but then really hone in on those operational workflows. And I think dress rehearsal was one of those opportunities. You wrote an excellent article. Our top article of 2022 was actually your dress rehearsal program with that behavioral health focus. You've attended a lot of them this year. And how does that really help our clients with the development of those workflows?
Well, yeah, I think that's a key component, right, of really preparing the staff and really walking through a day in the life of working with these clients, right? There's so many pieces to the operational workflow, and really dealing with what's going to happen from, preparing the staff for their day, in terms of when checking the client in, admitting the client, how we're going to check for any contraband for the client. I mean, how we're going to do that risk assessment for the client, the flow of the client, getting them to and from their groups that they go to, getting them to and from, any therapy, medication, all of that. And then also the unexpected. What happens if the clients get in some kind of an altercation? What if the client presents with risk? What if the client is saying, I'm feeling like I want to hurt myself? How are we going to respond to that? And then that issues follow-up is so important in terms of what are we identifying throughout that dress rehearsal? What did we not expect to have happen? So we can identify all of that before we go into day one activation. The staff need to feel comfortable. I mean, in most cases, they're going to be brand new staff that we're hiring that have never worked together as a team. They need to be comfortable with each other. They need to be comfortable with their workflow. And then a lot of times we're introducing new equipment. Maybe it's an EMR that they've never worked with before. Maybe it's Pyxis. They've never worked with medication delivery system before. So we want to make sure they're fully comfortable in any issues that we've identified that we're able to follow up on. So that dress rehearsal is so important, and just reducing the anxiety of the staff before we start and we have day one. I think staff will tell you, I've worked in so many facilities where we get feedback from staff, and when staff are not satisfied, the number one reason they're not satisfied is they don't feel like they've had enough training. That is the number one reason why they're not satisfied. They don't feel like they've had enough support. They don't feel like they've had enough training. So I think the dress rehearsal is just one more way where we can support staff in their training and their confidence.
Thank you for that. So you touched on some new features in buildings that we're seeing. We're fortunate. We get education from you all the time, but can you give our listeners some trends that you are seeing in the behavioral health field that are helping address some of those gaps in design?
Yeah, absolutely. I think we have all seen pictures of the institutions dating back from the 30s, 40s, and 50s. So we've come a long way since then. And it was really exciting to go to some of these workshops and see all the innovative ideas they've come up with. And one of the things with recovery, and one of the reasons, it's so different, behavioral health patients are so different, is research has really shown that if they have a voice in their recovery, they're going to recover much quicker. So we really want to give patients a voice and a choice in their recovery. So the designers are really recognizing that. It was really cool to see some of the innovations that they've come up with. Lighting. So they've come up with these rooms where patients can change the color of the lighting in their room, which was really cool. Like even if for kids, that's a great idea, just to give them some control over their environment. They can move their rooms or their room furniture around and put it how they want to put it. For pediatric clients, in medical facilities, I know when my daughter got her tonsils out, I got to spend the night with her. She would have been traumatized at 8 if she would have had to spend the night by herself. Well, I know for behavioral health clients, if they're young, they go and they have to spend the night, for a week at a time by themselves. They're recognizing that that's, not very trauma informed. So now they're putting beds for parents. So if a little kid needs to go in, for a week in a psychiatric facility, the parent gets to spend the night with them. So I thought those are some great innovations. For safety, we already talked about ligature resistant. They're coming up with some great ways to make safe environments, but also make it look aesthetically, pleasing in the environment. It doesn't look institutional. They're making some great doors that are safe, but they're still ligature resistant. They look kind of like barn doors. The furniture is looking much better. It doesn't look kind of that institutional. It looks much more home-like. It used to be when you're in, when you're in, you have two choices. You can either be in your room or this big, huge community room. Well, not everybody wants to either isolate or be social. So they're building kind of these little nooks where you can kind of be social and around people, but you can also be by yourself, and kind of read in a little, kind of a little niche if you want. So being much more mindful of people's control over their own space. So it's really neat to see all those great creative ideas that people are bringing to design.
I find that really interesting. And as a parent, I very much, that resonates with me a lot. Like, I can't imagine my young children saying like, I'm good by myself. And I think it's really considerate finally to say, this is something that needs to be addressed. Children shouldn't have to be separated from their parents. So great design elements. And we've actually got to see those across the country on several of the projects that we're working on. Something that you've educated us on, and we're very aware of from the transition and activation side of the various patient populations, med-surg, ICU, labor and delivery, NICU, et cetera. You've talked about the continuum of care for the behavioral health patient population. Can you just briefly share what that looks like and the various types of facilities that are being developed to address those different types of population?
Yeah, absolutely. Yeah, we talked a little bit about, the influx of the emergency departments and how they're just getting bombarded with behavioral health clients. So, the answer is not to simply just build more inpatient beds. That's, I think we're recognizing that is not the answer. That seemed to be the answer about 20 years ago, is build more beds, but it's just a short-term solution. So we're really looking now at that continuum of care. And as we're looking at new projects, and you and I have seen quite a few, they're really campuses, and they're really cool, right? They're building these huge campuses, and maybe there's, one or two units that are inpatient, but the rest are these really innovative models where maybe one, you've got a residential center, you've got kind of an acute, short-term, residential model, you've got outpatient. So it's really a continuum of care. So it's built to be, from outpatient all the way to, acute psychiatric and kind of everything in between. So we're not just putting a Band-Aid where let's just build some short-term, psychiatric beds. We're also seeing some really innovative programs where they're using their emergency department space, right? But designating some beds to be very short-term, like less than 24-hour alternatives to the ED, right? So they're building them so they've got a psychiatrist and a social worker. So they're taking those patients, they're taking them out of the ED, and they're doing really, really intensive, it's psychiatric kind of emergency work with them, taking them out of the ED. They've got their own, it's a very calming space. It doesn't look like an ED at all. It's very trauma informed, but let's get you on medication as soon as possible. Let's get a social worker, a case manager. Let's get you referred for a follow-up appointment, within 48 hours, and let's get you some medication. Let's get you sent home so you can recover and get you out of the ED. We've all been in EDs and know how traumatizing that is. It's super loud. There's bright lights. There's lots of stuff going on. It's nowhere where somebody with a mental health crisis is going to recover. So it's really good to see that continuum of care. It keeps people out of, nobody wants to be in an inpatient unit. It's super expensive. It's not the best level of care. So that continuum of care, you get people before they get that acute, and then it's aftercare if they do have to go into inpatient, it's immediate aftercare. It's much less expensive and much more effective and efficient. So it's great to see those campuses going up. And they also have a lot of telehealth models built in. You and I are seeing that. Everything we see is how it has a lot of telehealth rooms. We saw those popping up in the pandemic, and they're proving to be very, very cost effective and efficient. And a lot of clients like it much better than having to drive for an appointment. So
well, it's very convenient. And
yeah.
to your point earlier, I think just normalizing the conversation, right? Addressing it before it becomes something large. So if I'm feeling uncomfortable, if I'm feeling anxious, addressing that before it becomes depression, before it becomes something much more serious that then requires a much more escalated form of care. So I love that fact. As a mother, I'm receiving stuff from even schools now that have these behavioral health classes that parents can take so that we're educated, right? We're not just ignoring a problem and saying this is normal teen angst or this is normal child behavior, and we're saying it's okay to talk about it now. So
Yeah.
I love that you have educated us, and we appreciate just all of your experience that you've brought. So speaking of experience, you've been in the field, you said, for almost 35 years. And I know this is a hard question, but what has been your biggest lesson learned from your, thinking back to your first behavioral health activation experience to now that you still draw upon?
I think it probably, believe it or not, it'd probably be a more recent experience, right? I think it's probably not involving the clinician. And one of the two workshops, the healthcare design workshops I went to, what I really appreciated was they're recognizing the importance of the voice of the clinician. And one of the ones I went to, one of the workshops in particular, not only did they listen to the clinician, they had a team of stakeholders in one of their projects where they listened to, they actually listened to patients and family members of patients, which I thought was really, really cool, right? When they designed their facility. I hadn't heard that before, especially the family members. But one project in particular, it was a project that an agency had won an RFP, and they were really excited because the person I don't know, I don't want to disclose, but the building was already built, right? And it's super excited. We got this state of the art building. It's already built. We're looking for an operator to come on, mental health operator to come on and operate it. They were super excited about it. So when the agency went to look at the building, it was beautiful. It was gorgeous, brand new building. But when you did the walkthrough, and when you're looking at, and it was a crisis residential program, so patients would be living there, acute patients in acute behavioral health crisis, 2-story building, open stairwell with an elevator with no badge reader. So what could possibly go wrong in that situation with patients in an acute mental health crisis, right? So you've got an open stairwell, right? You've got a closed elevator that patients have access to. And the provider was going to have to double their staffing model because you had bedrooms on both floors with no line of sight. So there's no way you could have staff on both, monitoring. So it was just a great example of a gorgeous building that looked awesome, but functionally it was not going to work. So if you had a clinician from the beginning, they probably had a clinician, but they probably didn't have a clinician specializing in design, right? That would look at it with kind of the eagle eye that somebody with design in mind would have looked at. Now, there's some things you could do afterwards, like maybe put a badge reader on the elevator, but there's not much you could do about the open stairwell, right? And then you'd have to just really increase your budget for staffing on both levels. But sometimes you and we talk about like the building's built, we need to learn how to live in it, but
But, to your point, just, operational design, if you're there at design, you're coming up with this because, that's two of the main driving forces that we're seeing in all facilities, right? Is staff safety and patient safety. And we always say that's like a red flag, a high priority item that we want to address. So having that clinician at the forefront to identify some of those potential gaps can be cost saving, although it does maybe result in some iterations of design. Ultimately, it does pay off to have that clinician there. So I know the NIHD board actually posted that ROI. What's the return of investment on the clinician voice? And although costly at the forefront, a little bit more costly, it does end up paying off at the end with the overall design.
Yeah.
So, patient move planning is something that I know all of the clients we've worked with that have a project that's resulting in the transfer of patients. That's always what they want to talk about. They're always interested in it. Most folks have never done it before. So it's already complex, right? But then coordinating the transfer of behavioral health patients is an added layer of complexity that really requires some thoughtful consideration for both staff and patient safety. As a behavioral health specialist, can you share some items that healthcare leaders should keep top of mind when planning the move of behavioral health patients?
Yeah, absolutely. And I think you already touched on it. Obviously, the planning is huge, right? I mean, you have to have a very, very thorough move plan, and it's keeping in mind, I mean, how complex the patients are. We already talked about the importance of behavioral health clients really having a voice in their recovery. Sorry, Oliver has some feedback on this topic as well. I would involve the patients in their move plan, right? I would ask them what's important to them, and I would take those considerations to heart, right? As much as we can take their suggestions in, I would take them in. I would give them as much notice as possible of the move, so that they're aware. I would give their family members as much notice as we possibly can, keeping in mind their timeline. I don't know, it depends if it's a residential long-term facility or more of an acute short-term. Obviously, if they're not going to be involved in the move, we're not going to notify them of the move. If they're forensic patients, I know we did have a move with forensic patients. Keep in mind that often our patients have had very negative encounters with police, and just seeing police can trigger them. So if there needs to be a police presence during the move, we need to have a specific plan with that, because we can expect that that's going to trigger them and they're going to decompensate. We need to have a plan for that. I think we need to have some kind of plan for the day and expect delays. We can't control when the ambulance shows up. So we need to have some kind of a planned activity for the day to keep the patients busy during the day, knowing there's going to be delays both on the front end, the existing facility, and the new facility. I think we can expect changes in the patients throughout the day of leading up to the move and the day of the move. So I would have frequent check-in meetings and plan for those both the day before, the morning of, and throughout the day of the move. Contraband and safety is number one. So we need to have a plan for checking the patients before they leave the existing facility and before they enter the new facility. So I think you're seeing where I'm going. There's just a lot of planning and a lot of logistics. I think communication with the patients throughout the day, if we can have their therapists there, their clinicians there throughout the move, that would be very, very helpful to support them. If we can show them, just to help them prepare, if we could show them the new facility, that would be great. If we can't, if we can take pictures or video and show them just so they know what to expect. Obviously, they're going to be super anxious. They don't know what to expect. It's a new move. Again, it just depends on what type of facility. If it's residential, it's going to be much more meaningful versus if it's an acute and there's going to be there for another day or two, that's much different. But a residential is a pretty significant move. That's kind of their home. And don't forget to involve family members, right? And even have them, if we can have them there, if they're supportive, that would be great to have them there and have them engaged. And then the rest of it is all that project management, right? Arranging for the ambulances and the strategic part of the move. I think I touched on hopefully most of it.
No, I think you touched on all of it. And you certainly have had our experience moving behavioral health patients. And, we continue to see that trend. So addressing staff safety, patient safety, and ultimately, I loved how you touched on just reducing the overall anxiety, right? Because, it's already anxious to be in the hospital. And, we don't want to add to that overall experience for the patient in a negative way. We want to calm them down. We want to ensure that they have, that we have a solid plan. And that's our overall objective in general when approaching a patient move. So thank you for sharing that. Well, we're on our final question. And it is, if somebody, is interested in leading or planning the activation of a new behavioral health space, and just are looking for some advice or, where to begin, what would you say?
Well, I think we say it all the time at Yellow Brick, right? Give yourself a long runway, right? In terms of engaging the activation piece of it, right? Make sure you leave plenty of time for that project management piece of it. And I think just recognize that it's a specialty, right? Recognize that behavioral health is its own specialty. These are very, very complex clients, and that one size fit all activation and planning project management just doesn't apply. We need to treat it as its own specialty, which I'm really glad to see most people are starting to do. We talked about the design element. Really get a behavioral health clinician in on the design as soon as possible. It will save you money and headaches, right? It'll pay for itself in the long run. And I think I would say just have fun. It's like an exciting time to be able to build just a really innovative state-of-the-art behavioral health facility. It's so needed right now. So I would say really enjoy it. It would be so great to be a part of that. So I would just say get your team on board and have fun. Yeah.
Well, all right, Donna. Speaking of fun, I know you and I had the opportunity to discuss some of our dialogue today prior to actually sitting down this morning. But now it's time for some rapid fire questions that
Uh-oh.
you have not seen. And as the self-appointed Yellow Brick Fund Committee president, I assume you're game. Is that right?
Let's go. Let's go.
Okay, are you ready?
I'm ready.
Okay, I'm going to start with a softball, easy one. Dogs or cats?
Oh, I think you heard definitely dogs.
Dogs. Our listeners who don't know, Donna's dog actually won Employee of the Month this year. Donna, can you share a little bit about your dogs, but the one dog that you love more than the other?
Well, I can't say I love him more than the other because they're both within earshot of each other. But Oliver is he's my rescue pup. He's got a big birthday coming up. He's going to be 4 years old on December 23rd. He's an adopted Chihuahua mix. So he's my big giant, he's my big baby. He's not really big. He's only 18. He's 18 and a half pounds.
That's big for a Chihuahua. So.
He's a little on the chunky side. So.
All right. Favorite winter beverage?
I don't drink hot beverages.
Okay.
So I'm gonna have to
need to be hot. It can be just something wintry.
I'm gonna have to go with Coke Zero. It's my go-to beverage. Coke Zero.
All seasons.
It's my all-season go-to. Yeah. Yeah.
Favorite song?
Oh, my favorite song is Ooh La La by Rod Stewart.
Ooh La La by Rod Stewart. Okay, we love some
Yep.
Rod Stewart. Hot
Yep.
pants. I like it.
Mhm.
If you could go on vacation right now, like drop this podcast, go out the door, where would it be?
I think right now I'm going to go to Australia.
Ooh.
Yeah, I'm going to go to Australia.
I
Wait, what season is it right now in Australia? I think it might be summer there.
I'm a communications major, not a geography major, so I have no clue.
If it's summer there, it's really a bonus. Then I'm really going.
Okay, but I heard Australia has some of the deadliest animals, according to my fun fact champion son. So I'm a little afraid of Australia.
Oh.
Okay, here is the hard question that So the World Cup is happening right now. For anyone that knows, it is a big deal pretty much everywhere in the world. So I'm going to give you 3 player names.
Oh,
and you're going to tell me or guess what country they play for.
This is an epic fail, but go ahead.
Okay. All right. I'm starting really easy. I got 2 easy ones and 1 hard one. Cristiano Ronaldo.
So I should guess what country he plays for?
Correct.
Can I have 3 choices?
Mexico, the United States, or Portugal?
Portugal.
Oh, okay. Ding, ding, ding. You got 1 right. Okay. Lionel Messi.
Can I have 3 choices?
I'll give you flag colors, blue and white. And they're in South America.
I have no idea.
Argentina. So for those that know, Lionel Messi has never won a World Cup. He's won, for one of the top players ever. And he is currently doing pretty good. So, and this one, I'm going to just say, you probably have no clue, but I'll give you some choices. This guy is an up and comer. Kylian Mbappe. And your choices are Germany, France, or Spain.
Mbappe. I'm going to go Spain.
It is France, and France is also doing. So for those who are listening to this podcast, who knows who won, but it might be France or Argentina, and that's who we're seeing go to the final probably. So we'll see if my guesses are correct. All right. Donna, who's your hero?
Huge disappointment.
Huge disappointment, but it's okay. We found out you do not like soccer. Who is your hero? Someone who inspires you?
You know what? You know what I'm going to say? Because I just finished reading her autobiography is Viola Davis.
Oh, I'm actually, thank you, Donna, for that recommendation. I also enjoy that. Why is she inspiring you?
Just hearing her story, right? The trauma that she endured and how she just came out of that, and just, yeah, so inspiring. I've recommended that book to so many people. It's just amazing.
Well,
Yeah.
this flows right into my next question then. For listeners that are listening, the last book you read that you would actually recommend, and that book is?
Becoming Me, Viola Davis.
It is great. Listeners, definitely, if you're listening on Audible, it's a great listen and benefit. Viola actually narrates it, so she's got an
Yeah.
Okay,
Yeah.
final question. And I told you
Oh.
this one was going to be coming. It's the end of the year. People are starting to think of, what am I going to do next year? So what's your New Year's resolution?
Right. So here, a fun fact about me, I never, my New Year's resolutions are never painful. I always pick something super fun, and my friends make fun of me. They're like, that can't be a New Year's resolution. Like last year, my New Year's resolution was to go to Hawaii.
Hey.
And I didn't think I was going to make it. And then we got a project in Hawaii. How great is my life, right?
And we get to hear about it all the time.
So my New Year's resolution, because you know I love playing pickleball, my New Year's resolution is to actually play in a pickleball tournament for 2023.
Oh, I will be your number one spectator. So
yep, I'm packing up my paddle and taking it on the road for 2023.
All right, we're gonna see Donna, pickleball champion.
Well, I didn't say champion. I said playing. The bar is low. I said playing a tournament.
Winners at Yellow Brick. So
well, you can bring your whistle and tracksuit.
Okay, if listeners want to get in contact with you, how can they reach out to you? Do you have a LinkedIn?
I do have a LinkedIn. I absolutely do.
All right. Well, there you have it. Reach out to Donna if you have some questions. I know she's super responsive and active on that site. Well, wonderful. That actually does it for this season of Transition Tea. We want to thank our listeners for all their support this year. We actually launched this podcast in 2022 and are very excited to say we're bringing it back in 2023. So on our next season of Transition Tea, we're going to continue to meet with healthcare leaders from across the country and chat over best practices, new insights, and transition at expertise. We thank you so much for listening and following us this season. If you want to hear more conversations like this one with Donna, please subscribe to our Transition Tea podcast on Spotify, Apple Podcasts, or wherever you enjoy your podcast. And if you actually want to see this video, see Donna and I have some fun, you can follow us on YouTube, where all of our Transition Tea podcasts are loaded. Until next year, listeners, Happy New Year.